Hello and welcome to For Your Health. I'm Mark Crosby. I want to thank you for joining us for this particular program and all of the programs here at QATV. Today we will be talking about heart health. And joining me, as in programs past, is the Public Health Nurse Coordinator here in the City of Quincy. That would be Caitlin Pico. So Caitlin, welcome back.
Thank you for having me, as always.
Always a pleasure to have you. Again, thank you for your work, your preparation for these programs. These programs not only benefit the folks living in Quincy, but as we have talked about in the past, they benefit the folks really countrywide.
Yes, and with any of my information, I always, today I got the information right off the American Heart Association. I believe their website is heart.org, but I always try to keep the information very universal, so it does apply statewide.
And countrywide.
Countrywide, yes.
Let's look at the outline, because that's a good way to begin. You agree?
Yes.
Okay, what is a heart attack? So we are talking about heart attack and sudden cardiac arrest. That's the topic for today. So definition, what is a heart attack? We'll look at signs and symptoms, what to do for a heart attack, what is cardiac arrest, signs and symptoms of cardiac arrest, what to do for cardiac arrest, and the link between heart attack and cardiac arrest, and lastly, prevention, which is always the most important. If you could prevent it in the first place, you're doing well.
Yes, yes.
So I'm going to turn to you and ask you, although it might seem like everybody would know this, but what is a heart attack?
I really wanted to get into the differences between a heart attack and sudden cardiac arrest, and again, how you would respond, because a lot of times these are sudden events, and you want to make sure if you are in that circumstance or if somebody around you is, that you react quickly.
Because of course seconds count.
Yes, anything with the heart, with your circulation, minutes count. If your organs go without the blood, they will start to die. So it's very important to act fast to get medical help. So we'll start off with a heart attack. So according to the American Heart Association, a heart attack is a circulation problem. So this would happen when there is a blocked artery that prevents the oxygen-rich blood from circulating to that heart muscle. And again, if the blood is unable to get to that muscle, the heart muscle will end up starving without the oxygen. So again, this is an immediate medical emergency. And we'll review some of the signs and symptoms that go into this, so what to monitor for. Is that okay if I jump right in there?
You can jump right in,
okay.
Absolutely.
So for a heart attack, these symptoms can come on immediately and be intense, or others can be very mild. So what you might see with a heart attack, the most common that people know of is the chest discomfort. So this can be an uncomfortable pressure or squeezing or a feeling of fullness. It's typically in the center of your chest. It can persist for several minutes, or it could come and go away. People may also notice they could have discomfort in one or both of your arms, your back, your neck, jaw, and stomach.
See, I always thought it was just the arm and then possibly the chest, but there's actually a lot of areas that you can feel discomfort.
Yes, and it can be tough because with the body, of course, there are a lot of symptoms you could experience could come from it could be a different health condition you're going through. But if it's new, sudden onset pain, definitely I would say call 911. Doesn't hurt to rule it out. Individuals might often see shortness of breath. That could be with or without that chest pain. And it's also very important to know that men and women can experience a little different. So although women typically will have that chest pain, sometimes it will exacerbate with just back pain shortness in breath, and nausea and vomiting. So what we tend to see is a lot of females who have these symptoms, they just brush it off. Say if they had acid reflux, they might say that their nausea vomiting is based on that. So we always say, especially if it's new symptoms, check in with your doctor. If it's chronic symptoms, make sure your doctor is aware of it, so at least they know what to monitor for, and they can give you the guidelines of what you should be looking out for in case of an emergency.
Well, I'm glad you said that, because doctors aren't magicians, they aren't miracle workers, I guess, and they need input beyond
Yes.
what a test could tell them. They really need to hear from their patients.
Yes, and I often find, especially with chronic conditions, even keeping a journal of, if you say you do have chest pain that's chronic, hopefully your provider is aware of it. Keep a journal, because they will chart if you reach out to them, but if you go to a doctor's appointment and they ask you how many times you had chest pain that week, it's so hard to remember that just with our everyday lives. So keeping a journal of your symptoms could be very helpful.
That's a good point. I think I'm laughing, but I think I could actually benefit from having a journal sometimes.
Yes, yes. So it's definitely any of these symptoms, definitely keep an eye out for them. Whether it's happening to yourself or someone around you, when in doubt, if you believe it's a heart attack, call 911. Even if it's not a heart attack, at least EMS can come out to evaluate and assess to see if additional medical interventions is necessary. Because again, with a heart attack, minutes count, so you want to make sure that that help is on its way.
See, I'm surprised that the back, I didn't realize that back pain can be an indicator.
Yeah, so it can tend to be different in different people. So that's why you really want to know yourself. Of course, I'll get into it with prevention, but if you are somebody with cardiac conditions, make sure you're keeping in close contact with your provider, keep in touch with follow-up visits, because you want to make sure you're preventing this from happening, because you don't want to have a heart attack, of course.
Right, right. And now we're talking about what to do if you have a heart attack.
Yes. So again, I quickly mentioned that if you experience any of those symptoms, call 911. It's important to know that, so EMS staff, so that would be your ambulance, your first responders. So upon arrival, they can treat, if it were to be a heart attack, they can provide treatment right away. I didn't go deep into all the different medications and techniques they use just because it's very extensive. But typically they'll give you an anticoagulant to thin your blood to help reduce that the blockage. And then they also can do surgery to go in and actually take the blockage right out to reinstate the blood flow to the heart. So it's better to call EMS rather than drive to the hospital, because one, they can start that treatment upon arrival to the scene, and also they are trained in resuscitation efforts as well. So if it was a heart attack and the person is then unconscious by the time EMS comes, they'll quickly be able to initiate intervention.
Right, because if someone is driving you, or if you think you can drive yourself, you could get stuck in traffic. There's a lot. And of course, like you said, your car or someone else's car doesn't have the equipment.
Yes, and definitely the traffic, if you're on that ambulance, of course, they'll have the lights to get you there. And they also
The traffic might even make it worse.
Yes.
Right?
In
Stress.
arriving by an ambulance, especially with chest pain, it should prioritize your treatment so you can get right into that ER, because of course they can get overwhelmed. So you want to make sure that you are prioritized to be seen right away.
hospitals commonly use techniques to restore blood flow to the part of the heart muscle damaged, because there is damage there.
So there would be, depending on how long the muscle goes without that oxygen, that depicts how bad the starvation and how bad the damage to the muscle would be. But you want to make sure that you're getting that treatment right away to reinitiate that blood flow, because as long as you are going without oxygen, the worse your post symptoms would be.
Right.
Yeah.
Right. Now we're going to look at cardiac arrest.
Yeah, so according to the American Heart Association, so where a heart attack is a circulation problem, a cardiac arrest is an electrical issue. So basically, your brain communicates to your body using electrodes to communicate back and forth. And so basically what happens is with cardiac arrest, there's an electrical malfunction, and this is caused by an arrhythmia, otherwise known as an irregular heartbeat. So this irregular heartbeat disrupts the muscle's ability to pump the blood. So in this circumstance, your heart would stop beating, whereas in a heart attack, your heart continues to beat typically.
Right, it's just the blockage
Yes.
beyond the heart in the heart attack case.
Yes. So with cardiac arrest, so without being able to pump, of course, the oxygenated blood is not going to your brain, your lungs, or your other organs. And again, this is a medical emergency. And it's important to know that cardiac arrest is a leading cause of death in the United States annually.
Serious issues. Now that I'm looking at this and now that you're speaking, I guess I always assumed cardiac arrest and heart attack were one in the same, but I understand the difference now.
Yeah, so it is two different things. So heart attack, you want to think that's your circulation, whereas sudden cardiac arrest is the electrical malfunction. So basically what you see, the difference in the symptoms, so with cardiac arrest, this occurs suddenly and often without warning. And the individual that is experiencing the cardiac arrest will often lose consciousness very quickly, and when you palpitate for the pulse, you won't feel a pulse because that, again, the heart has stopped beating.
So with heart attack, there's a clog. With cardiac arrest, there is no clog.
Yes, there is no clog. So what you need to do, where it's different, so now we'll go into how you treat cardiac arrest. So it's a slightly different between adults and children. So at first for adults, you want to check if they're responsive. So you go up to this by asking the person, are you okay? Can I help you? You would check for that pulse. If you're alone, what they suggest is dial 911 to initiate that first responders. And then you would want to get, if you have an automated external defibrillator, otherwise known as an AED, you would want to get that out and initiate high quality CPR immediately. So it's four main, it seems a lot all at once. If you are the only person there, you're the only person responding, call 911. If you know where the AED is, grab it and you would apply the pads to the person's chest. If you don't know where there's an AED, don't waste time trying to find it. Just initiate that CPR until help arrives. And I just wanted to say that with these AEDs, they're very great because when you open the kit, you press a big green button and it verbally walks you through what to do. It will say, open the pads, apply, and it will show you a picture where to apply the pads. And that would also, so that's calculating the electrical currents in your heart. So it actually will scan it will talk to you and say clear the body, so CPR would stop at that time. It scans to see if electrical shock has to be given. If it is, you press the button and it shocks the patient, and then you continue CPR. Just where there, with CPR training, it is very in-depth, so I didn't want to go into too much here. But the Red Cross and Brewster Ambulance, along with every community, can find a CPR class in their area.
Sounds like we should all be certified in CPR.
Yes, it's good to, because you never know, this can happen anywhere, on a train, in a restaurant, so you want to know. I also like to say, a lot of public buildings and workplaces will have an AED available. So especially if you're at work, kind of know where that is, because in an emergency you don't want to go running to find it, because again, minutes and seconds matter. And I also wanted to quickly say that if you are not certified in CPR, according to the American Heart Association, they hands-only CPR, they say to the beat of that classic disco song, Staying Alive.
Interesting.
Yeah, so it's you would want to beat, and it's basically like 100 compressions a minute that you would be going to, and you right on the individual's chest, and you do want to do pretty deep compressions, about 2 inches deep. But again, for additional training, you can reach out to your local Board of Health to find training in your area where to sign up.
I wonder if people are concerned, if they are performing CPR on someone, about ribs and potentially breaking a rib.
Yeah, so anything, what we say with that is you would rather be alive with a broken rib than not alive. So it's really prioritizing getting that blood circulating, and you would continue this until help arrives.
So you said push hard, middle of the chest, at least 2 inches deep, and at a rate of at least 100 compressions per minute, which would be, I guess, in keeping with the song, Staying Alive.
Yes, so Staying Alive, you got to go to the chorus of that song, and you just keep pressing. Just
not the verse,
sing
the
it,
chorus.
Yeah,
Right,
you can sing it in your head.
For children and infants.
Yeah, so for children and infants, where this gets a little different, so if you have 2 people with you responding, one person starts compressions for CPR, and you would have that other person call 911 to get them on the way, and also to grab the AED. It's important to know that the pads, most AEDs come with pads for children as well. But if there are only adult pads in the kit, there will be instructions to say how to utilize that on a child, depending on the child's size. So again, with that, know where your AED is in your facility. Actually, if you could open it and see the materials in there, it's important to know, are your kits, are the pads expired or anything like that.
So check it out ahead of time. That's good. And also, I suppose the person that is suffering a heart attack or cardiac arrest, as far as applying CPR or an AED, they should be on a flat surface. They should be flat.
Yes, on a flat surface, you always want to make sure you're in a safe spot. So for example, if you're on a pool, like a pool side, and you drag somebody out of a swimming pool that might be experiencing sudden cardiac arrest, you want to make sure if you're applying the pads that they're not laying in a puddle of water, because that can also transfer the electrical currents.
Right, good point.
So make sure you're in a safe space, and you might have to drag the person to a safe place if deemed possible.
So we're looking at a link now, possibly between
Yes.
heart attacks and cardiac arrest?
Real quickly, before I get to that, I forgot to mention, so with the children, a lot of times the cause for their cardiac arrest can be because of an airway obstruction. So maybe they choked and went unconscious. So you want to make sure if you are alone, you start that CPR first prior to just leaving the child to call 911. We're pretty lucky nowadays with cell phones. If you are alone, people normally have a cell phone on them. So my suggestion would to be, if you have your cell phone, dial 911, put it on speakerphone, and just start those chest compressions. So that way you can relay the information while also providing CPR.
Right, yeah, that's so true. You don't think about it, but now that we all have cell phones, it's not like we have to travel to the nearest corner to make a phone
Yes.
call.
So
it saves, you would think it saves a lot more lives,
Yes, a lot easier to get in touch with help, which is nice.
which is good. Let's talk about the link now between heart attack and cardiac arrest.
Yeah, so the major link between heart attack and cardiac arrest is that if a person who experiences a heart attack is at an increased risk for then having sudden cardiac arrest. So it doesn't always happen simultaneously. Some people may have a heart attack and during their recovery may experience that the sudden cardiac arrest. So that's the major link between the two. If you have had a heart attack in the past, definitely collaborate with your doctor, know your warning signs, and know the lifestyle changes that need to be made in order to reduce your risk of heart complications.
Now, briefly, if you could, how does, I suppose, stroke play into cardiac arrest or heart attack?
So a stroke can also happen because if you're thinking like a heart attack, you have a blood clot
Right.
somewhere along your track. That would be before the heart. So in a stroke, that clot would be blocking it to your brain. So I'd have to do a little bit more research.
But that's the basics.
Yeah.
Yeah, okay.
Basically, they could all kind of coordinate together. So really, lifestyle changes for a healthy heart is going to reduce your risk at stroke, reduce the risk for heart attack. So it's all kind of intertwined.
Prevention at the top of the list shouldn't be anyone's surprise. Stop smoking.
Yes, so all of these measures, people have heard them again and again.
Especially smoking.
Yeah, so smoking cigarettes does increase your risk of cardiac disease, coronary artery disease. It builds the plaque within your arteries. So number one, and I will always say, stop smoking. It's not good for anybody. So
And don't start. That's the biggest thing. Don't start that path in the first place.
yes, and luckily nowadays, hopefully generations to come won't be smoking as much with all the knowledge out there. But here's to hoping that does dwindle down. And then next, you would want to maintain a healthy diet. So this diet would emphasize taking in vegetables, fruit, whole grains, low-fat dairy products, poultry, fish, legumes, which I believe is a type of bean.
I think so. I don't know if I've ever had, I suppose I have had those, but yes, I have heard about that.
Yes.
That in relation to beans.
I mentioned it, we do a way to go nutritional class at the senior center, and I mentioned it several times. I still don't know what that vegetable is, so I'll have to look that up. I believe it's a bean. There's also non-tropical vegetable oils and nuts, and then you want to limit your intake of sweets, sugar-sweetened beverages, and red meats. And then
I knew about the red meat. That I knew.
Yes.
What about fats and saturated fats and trans fats?
Yeah, so there's so much out there with nutrition these days because, again, your body does need some fats in order to operate. So really what I would suggest to people is just read your labels. And a lot of the grocery store now will have a check mark if it is a heart-healthy food item. I believe it's the American Heart Association that provides that check mark. So they review foods that they deem for a healthy diet, basically.
My wife is a big fan of Cheerios, and I think those are considered heart healthy, probably because of the grain.
Yes, and it also, they always advertise for their lowered cholesterol and all of that, so that's definitely on an item on the list that's healthy to eat.
We could all reduce stress. That could be so important, and I suppose not only for this health condition, but would simply make us all feel better if we had less stress in our lives.
Because a lot of times stress exacerbates, like, it could lead to overeating. It can lead to, if you are a smoker, you may increase smoking in a stressful situation.
Right.
So basically, your body is a whole system. So if you're stressed out, the actions you're going to be doing, so like that overeating, the smoking, it's going to hurt your body even more. So I always say, and I'm one to talk because I always call my mom when I'm in a stressful situation, but I found like
So call somebody isn't a bad thing.
Call somebody,
Right, good.
go for walks. That's another thing that can help prevention for your cardiac health, is increasing your physical activity every day. So you want to make sure you are going for walks, and
we're not talking about hikes. We're just
Yes.
talking about walks.
just anything more than your average. So if you normally get up and if you're sitting in a recliner all day, maybe if you had some light weights to work out, any increase in your physical activity helps you overall. And then the last one we had on the list is you would want to limit your alcohol as well, because drinking alcohol can increase your blood pressure, increase cardiomyopathy, your chances of stroke, cancer, and other diseases.
Very good. Well done.
Yes. And I just wanted to mention again, so all of this information and additional information can be found on the American Heart Association, which is heart.org. And you can reach out to your local Board of Health if you are interested in training. If they don't provide it themselves, they could refer you where to go to find that training.
Very good. A great program with a lot of great information. I want to thank you for doing the research and for coming in and sharing.
Of course, thank you.
Thank you. And thank you at home for watching. Please continue to support your local public access station for more programming just like this.